Hello, everyone, and welcome back to the Loop Tube. It's myself, Jeanette Nashke, and my co-host, Brittany.
Jeanette, it's been so long. Welcome back.
I know. We had so much fun on spring break. Did you have a good little spring break?
What's spring break, Jeanette?
Oh, well, spring break to me is when you don't work. And so really anything that you're doing when you're not working to me is a great time. So I had a great time.
Okay. Thank you for just really
Oh, you mean you worked?
Yeah. I actually went over to take you. I was like, oh, it's time to go to lunch. I know Jeanette asked off for a couple days. Let me go over and grab her for lunch. Oh, you weren't there.
I was not there.
You were not there.
I was not there. Oh my gosh, I'm so sorry.
That's okay.
Sorry you had to eat at the hospital cafeteria all by yourself.
That is okay, ma'am.
Hope they had a good soup.
No, I don't know what happened to Methodist Hospital, but it needs some work.
I know. And they were doing so good. And lately it's just not been so awesome. But that's okay. It's going to come back. I feel like it's on a comeback. Today was actually pretty tasty.
Okay. I believe you.
Okay. Okay. Well, these girls do not want to hear about Methodist Hospital cafeteria food. Anyways, this episode is all about amenorrhea, which is just a really big word where your period is just not coming. So where did it go and why did it go missing? And we're going to talk about what all that means, when it can happen, and how to get it back if we need to get it back. Deal?
I like it. Let's go.
Awesome. Well, thank you guys for joining us again. I know that we took a little break there and I know that it's kind of getting back into the swing of things, but I'm excited about this topic because I do see it quite often, actually. I see a lot of women coming to me about their periods, whether they're heavy or whether they're light or whether they're just not happening at all. And this whole episode is going to be about the periods just not happening at all. So what is amenorrhea? Amenorrhea is when a girl does not have a period or absence of the bleeding for 3 months straight. Okay. So if they had a previous cycle every single month and they were regular and everything was good prior to that, and then they go 3 months without a period, that is what we call amenorrhea. And it's important that we talk about this because there's lots of reasons for this to happen. There's causes for concern. There's reasons that are pretty benign in nature and nothing to worry about, but there are different reasons. And so that's why Brittany and I thought it'd be a good thing for us to talk about.
I also think this is a good thing to talk about because when we were younger, think about, let's say, 5th grade. In 5th grade, what were you talking to your girlfriends about? I mean, maybe actually in 5th grade, I was talking to my girlfriends about like
sleepovers,
sleepovers,
basketball,
playing. What was it when you used to look in the mirror and say like,
oh, you did
bloody,
that?
bloody, was it Bloody Mary?
Yeah, I did. I am a chicken shit, and there's no way I was sitting in a mirror and turning the lights off and calling Bloody Mary. I didn't even do the Ouija board. I was a chicken and still am. I'm a chicken shit. You know this.
Yeah. Well, that's what I was doing. And though there was talk of, have you started your period? Like, I feel like that's when it started, right? And there was a little bit of a stigma if, you got to a certain age and you hadn't had your period, or there was a stigma like, oh, you've already started? Like what? So I think this will be a good episode, even for our young ladies too.
Absolutely. Absolutely. I think it's important because like I had a lady that came and saw me not too long ago and I asked her about her period. Cause if you're there seeing me for your annual exam or your well woman exam, I'm going to ask you how your period is. I'm going to ask you if it's happening every month or it's a couple months. And she was like, oh my God, Jeanette, it's great. I don't get a period. And I was like, really? And she wasn't on anything to prevent a period, like a birth control. So I was kind of questioning as to, okay, well, when's the last time you had a period? She's like, oh, I haven't had a period in like a year. And she was not pregnant. So I was like, well, this is actually not a good thing. We got to figure out why you're not getting a period. So as lovely as it may be that not having that bleeding episode for 5 to 7 days every month, we still need to figure out why you're not having a period if it's just not happening on its own. So anyways, there's lots of types, right? There's lots of types of what we call amenorrhea. What we call primary amenorrhea, right? That means that you've never started a period and that hasn't happened by the age of 15 to 16. That is what we call primary. You've never had a period, and we need to figure out why you still haven't started a period. And there's a couple of reasons why that would happen, and we're going to talk about those too. The next type of amenorrhea is something called secondary amenorrhea. And that's where you've had periods before, like we were just saying, But now you have gone to the point where you're not having periods for over 3 months. And so there's a difference there between never having a period or having a period and not no longer having it. The number one reason for women to not have a period, because they've basically, haven't had a period in 3 months, pregnancy, right?
Prego.
Yeah, prego girl. So, either you're trying to get pregnant or you're not trying to get pregnant, and it happens. If you haven't had a period in over 3 months and you're normally cycling pretty regularly every 28 to 32 days, then it's time to pee on a pregnancy stick.
Do you know, there's this new show out called The Pit. Have you watched it? I know I told you to watch it, but have you watched it?
Oh my God. I started it last night.
Isn't it wild?
I could get addicted to that show because it reminds me of where I started, right? ER trauma. It is, first of all, it's great medicine.
Right.
Like everything they're talking about is right on, like treatments and how you assess the patients. It's good medicine, unlike Grey's Anatomy, which is crap medicine. If you want my honest opinion.
Grey's Anatomy is like great drama. So
it's true.
So on The Pit, there is a guy that was, the main character is this guy that was on ER. And I remember a specific, it's like a core memory for me, and I'm not really sure why, a specific ER episode where there was a larger woman that came in to the ER with, I don't even remember exactly if it was like stomach cramps or whatever. And she actually ended up like giving birth at that point, but she had no clue that she was pregnant the entire time. And I thought that was so interesting. I'm like, how can you not know you're pregnant? Obviously she wasn't getting her period. And again, this is fictional. So I guess I shouldn't really like dig deep, but it is an interesting thing that people can go a very long time without being like, oh, hold on, I haven't had my period. Like maybe I am pregnant,
You're so right. You're so right. Like, I actually, true story, working in the emergency room, I had a lady who hadn't had a period in like 7 months. And she was having some significant abdominal pain. And, I was like, well, in the ER, we have to do something called a fast exam where they get an ultrasound and they do it really quick just to kind of check and make sure that there wasn't anything acute going on, like blood in the abdomen. So I put the probe on her belly and there's a baby in there. We're talking like a 7-month baby. And she was actually going into preterm labor is what this pain that she was having was. So she hadn't had any prenatal care that whole time. And she was just as surprised as I was when she saw that baby on the screen. So yeah, like it does happen. That's a real life thing. So moral of the story, if you haven't had a period and you're sexually active with no protection, pee on a stick.
Pee on a stick. Also another big cause, well, and most people would know that this is potentially causing it is if you're breastfeeding, obviously.
Oh, yeah. Yeah. And that's just because that progesterone is so high. The hormone that's really responsible and really cooking in our bodies during breastfeeding is the progesterone hormone. And when our progesterone is really high, it can make us amenorrheic or without a period. But I think it's important that a lot of women just trust that as a birth control. And that necessarily is not true. Just because you're not getting a period doesn't mean you can't get pregnant during breastfeeding. So that's important. Ta-da.
I have some friends that did not listen to that.
Yeah, it can happen.
And then lastly, another obvious one would be menopause.
Oh, the good old menopause, right? Like, our bodies basically, they're like, okay, yeah, we're done. And they just basically stop kicking out that estrogen progesterone combo. And that's when we stop having a period. And we could clinically classify you as menopausal if you have previously had a period and then you go without a period for a whole year, right? Average age of menopause is 51. It obviously can happen sooner than that. I do have some ladies that have gone into early menopause. I have some ladies that are still bleeding at the age of 56, right? So it really just depends on the patient. But a really good way to test this would be if you've had a period and you no longer had a period and you're almost pushing a year, is to draw something called a follicle stimulating hormone or an FSH. That is a lab that will definitely tell us, hey, you're menopausal, or no, you're just not getting a period. That's helpful. Some hormonal imbalances, right? There's some specific one that we talked about before, and we did a whole episode on this, was the PCOS or polycystic ovarian syndrome. These ladies tend to not get a period, or if they do, it's what we call oligomenorrhea. Amenorrhea means not bleeding. Oligomenorrhea means you're just kind of, there's no rhyme or reason to it. It's kind of just happens and then it doesn't happen and it's kind of all over the place, but it's not a normal monthly cycle. With these ladies, they will come into me and we'll actually have a plan set where we either, hey, we need to either put you on a birth control that's going to protect that lining or that uterine lining or the inside of the wall of the uterus, so it doesn't get too thick, and put you on like a birth control to prevent that. Or we need to make you have a period every 3 months, which we do that with progesterone, something called Provera, actually. And we have you take that same dose for 10 days, and then that initiates a bleed. And the reason for all of that and the importance of all of that is because that lining, when it gets too thick, it can actually, those cells start to change, right? And then that can put us at risk for endometrial cancer or uterine cancer. So it's important that if you haven't had a period in over 3 months and you were normally bleeding prior to that, that you go see your provider, right? Because we got to figure out a reason for that. Mm-hmm. Another really big one is thyroid, right? So that can be either hypo, which is low functioning, or hyper, which is hyper functioning. And we did a whole episode on thyroid too, which is a really good one if you are just now listening to this episode and you have more questions about your thyroid. But that can really throw off your period too, especially the hyperthyroid ladies, because they're just like, their metabolic system is just on rapid, right?
Overdrive, yeah.
Yeah, exactly. And they're getting too thin, right? And the last thing their body is thinking about is procreating. So they literally go without a period. And then there's the flip side of that, where the metabolic system is slow churning, right? And those ladies tend to gain weight. And when they gain weight, they a lot of times don't have a period either, because their estrogen can get pretty high, and estrogen is stored in the fat cells. And so you're not having that normal function of the ups and downs of those hormones leading to a period. And then another one, and you probably have seen a patient with this, but pituitary gland issues. We have this little gland that sits in our brain, and it's called the pituitary gland. And it sends out a bunch of different signals, mostly stimulating hormones, right? Thyroid stimulating hormone, follicle stimulating hormone, luteinizing hormone, all the hormones that then send a signal down to the rest of our body to do its job. And if there's something going on there, like, for example, something called a prolactinoma, which is basically a benign little tumor that sits in that pituitary gland, it can cause our periods to also be different. Most of the time, what we call amenorrheic, or without a period. And so when I see you, one of my workups is actually checking a prolactin level, because I want to make sure that if you haven't had a period in 3 months, it's not something to do that's going on inside your brain. So I'll actually check and see if your prolactin's really high.
Okay.
Have you ever had a patient with that?
I definitely checked prolactin levels, but I haven't actually seen that. That doesn't mean I don't know how frequent that you are seeing that, but
yeah, it's not a real frequent thing, but it's crazy that when you catch them, it is, because it's not something that you're going to think all the time to order. But when you do order it and you and you get a high prolactin level, you're like, this absolutely could be what's going on. And then your next step is actually, you're going to have to get an MRI or a CT scan of the brain, and specifically of that pituitary gland, to see if there's like a little benign mass there. Okay. The great thing is these things are a lot of times benign, so nothing to really worry about. But these ladies, which is also kind of crazy, is they have basically milk, like breast milk leakage, and they're not even breastfeeding, and it's the prolactin, which is the hormone that comes down that tells you to lactate or create milk. You start actually having breast leakage, so that's another big symptom.
What a pearl! I like that.
Ta-da!
So there's also some like lifestyle and environmental factors that could lead to amenorrhea. I know the big one for our athletes would be that the amount of exercise is maybe a little too extreme. I thought I had extreme exercise happening, but I never experienced what they call athletes amenorrhea. I know we've talked about my athletic ability on here before.
Oh God, here we go.
Yeah. Okay. As always, it may have been the Pop-Tarts and the Dr. Pepper that were not allowing me to be able to reach the levels with extreme exercise. That just was never me. But I know that this is a big problem. I have a lot of friends that had this issue, especially when we're talking about people that are like in gymnastics. I know gymnastics is a big one where they are just like working out all the time, and it's really extreme. And I know a friend or two that has gotten this because they work like crazy track stars.
Marathon runners.
Yeah. Ooh, I don't know about a marathon.
Better
I don't think I have any friends that are marathon runners. If I do, I'm very impressed.
Oh, you're not a marathon runner?
I saw today that at the age of 40, you should be able to run a mile under 9 minutes.
Oh no. Oh no.
I think I could do it. I do.
Oh, 100%
I don't think I'd like it, but I think I could do it. But I really think for a lot of people that would be difficult.
Brittany, I know without a doubt you could do it. It would be me that would be dying.
I mean, you could power walk. Power walking's supposed to be better than running. So
can I skip?
I mean, you do whatever you can to get there 9 minutes and under. I bet you can do it.
Well, I'm going to start training. I'm starting to train and we're going to do this. We're gonna have a little competition.
You're making this an announcement. I'm fine doing a competition. I will do a competition any day. So
I know.
Okay, we'll bring this up again at a later date. Kind of piggybacking on top of that, another thing that could cause amenorrhea would be just like low body weight, or and that's potentially from someone that exercises like crazy, or also someone that may have like an eating disorder. We're talking about our anorexia, bulimia, things like that.
I know. And these are the hard ones, right? Because it's a really difficult topic for them to discuss, but also for us to bring up to them because we never want them to feel like we're shaming them in any way. But this is a big topic. I mean, this is something that thankfully you found somebody to come in for one of our next upcoming episodes. And we're going to do a whole topic on it, like eating disorders and kind of what to expect. And so I do think it's something that needs to be talked about, but I think it's going to be something that I know very well for me, I will learn from it. And I hope all of our ladies that listen, or men too, learn kind of how this can affect our bodies and what to look for.
Absolutely. And then another environmental thing would just be a high stress environment. I mean, this happened to me. I went to Spain. I'm sorry, let me say it the right way. I studied abroad in Spain.
Oh, you're so fancy.
And when I was there, I was away from my family and I was far away from my family. And at this point, all you could do to communicate would be, oh God, what is it called? Skype. Skype was the only way. I'm aging myself, but yeah, Skype was the only way to communicate. We didn't have iPhones at this point. And it was just stressful. I mean, I had a wonderful time, but when I initially got there, I think that level of stress affected me through the entire time. I was there for almost 6 months and I did not have a period once. Which was way out of character for me. I was a very regular at that point. So, I know. But shout out to Spain, Sevilla, Spain. One of the best experiences of my life.
You just didn't have a period.
And which was great, right? We say it's great when we don't have a period. Kidding. But like clearly my body was like, what's going on here?
Yeah. So it's true. Like I can't tell you how many times I see ladies that are like, my period hasn't been here for 2 months. Mm-hmm. And then I start questioning a little bit more and maybe they've just moved here or they are going through a breakup or maybe something even more stressful like medical is going on in their life or dealing with family issues or boyfriend or girlfriend issues. And it can absolutely affect your cycle. So stress is a huge proponent to our periods and how they can come and go.
Yeah. And another thing too is obviously being on birth control. And we know our we know our ladies that are like, I didn't take my sugar pills. Was that the right thing to do?
Yes.
Yeah. I mean,
the answer is yes.
It is. I mean, it's whatever. It really doesn't matter. But also, there's other medications that can affect your period. I know for me personally, I'm talking about myself a lot. I'm sorry. Spironolactone messed up my period.
Yes.
Really?
Yes, it did.
It was not, and it did nothing for my face. So
yeah. So spironolactone is a medication that I think we've talked about before. It helps with acne and it also helps with hair growth where you don't want hair growth. But Brittany was put on it for her skin to help with some acne she was dealing with. And yeah, it messed up her cycle big time.
Yeah.
So also I think it's important that there are some birth controls that you are not going to get a period on because it thins that lining that we were talking about so much that there's nothing there to bleed, right? Or if you're taking a birth control continuously, meaning you're skipping the placebos and going right next to the next pack, or you're keeping your NuvaRing in until the next ring and you never take a break from it, you're telling your body not to bleed. So that's okay. And that's medication induced. So it's okay.
Okay.
Here's another one that is not real popular, but it is a real thing. And that's structural issues, right? If there's something going on physically with the body, and that's going to be like a uterine scarring. There is something called Asherman syndrome, and I've only seen it once. And I was actually trying to put an IUD in a lady, and I could not get the IUD in. And I was like, huh, this is really actually kind of weird as to why I can't get this IUD in. So let me do an ultrasound. So brought the ultrasound in, did the ultrasound with our ultrasonographer, and she was like, "There's just a lot of scarring going on." And I was like, "Huh." She showed me kind of what the endometrium looked like, which is where I placed the IUD, and it looked crazy, right? I couldn't figure out what it was. So we basically said, "Hey, look, I'm not going to try to stick something like an IUD in there unguided and try to, I could possibly mess something up. I could, cause some further damage." So I decided to not pursue that procedure at that point. Well, she ended up having a hysteroscopy where we go in and look with a camera, and she's asleep. And she ended up having Asherman syndrome. And that's basically our Ashermans, however you want to say it. And it's basically where the uterus itself is so scarred down that you can't even open up that uterus. And so you could see the scarring throughout there. So when I was trying to place that IUD, I was just hitting those scars and I wasn't able to place it for her. So she ended up needing a different type of birth control, but I just thought that was really interesting.
Interesting. I've never seen it in practice.
Mm-hmm.
So
yeah. Another one is like a congenital abnormality. So these are happen in utero when we're being formed inside our mother's uterus, and it's basically where our uterus doesn't completely form all the way, and that's called a Müllerian abnormality. So it could be where your uterus doesn't separate and divide, right? And it creates more of like a bicornate uterus. That can happen, but that is a possibility for that to happen. And so when that happens, the only way we're going to find that out is actually with imaging or ultrasonography. So this is going to be one of those primary amenorrheas, though, right? That's going to be where you never really had a period, and now we're working you up as to why you haven't started.
Right. So when is it too long without a period? Like when do I need to go see a doctor? What is the time frame that you would say?
Well, I would say that if you haven't had a period in 3 months when you were normally having a period prior to that, then it's time to come see us, right? Because we need to probably get some blood work on you and get an ultrasound, see what's going on. If you are, 40 and up, and it's been 3 months, probably a good idea to go see us. But the other thing is, like we talked about earlier, say you're 49, 50 and you haven't had a period in 3 months, there's a good chance that you're just probably menopausal, right? Especially if all of that is associated with the hot flashes, the night sweats, the irritability, the brain fog, all those menopausal symptoms that we've talked about before too. So, that's going to be part of the history and physical that we do too. When you come in and see us, we're going to ask all those questions. Mm-hmm. We want to know if you're still cycling normally and you're just not bleeding, or if you're not cycling at all, and kind of figure out what's happening there.
Okay. So we come into the office, or I'm sorry, a patient comes into the office.
Mm-hmm.
We're going to do the workup, like you said. And
right.
How are we going to treat this? What are the next steps?
Yeah. So say you come and see me and I do an ultrasound and I find what we call a string of pearls pattern on your ultrasound. And that means you've got small little cysts kind of connecting all through the both lining of your ovaries. And I get your blood work back, and your follicle stimulating hormone, or FSH, is in pre-menopausal range, meaning you should still be having a period, and your estrogen is there. And I see your lining, and your lining looks pretty normal, right? It's not too thick and it's not too thin. I will most likely initiate a period, right? Because I want to do something called a progesterone challenge. I want to give you progesterone, and I want you to take it for 10 days. And after you take it for 10 days, you should start a period. And if you don't start a period, that's when we need to do a further workup, right? Because that 10 days of progesterone should kick your body into thinking, hey, it's now gone. The progesterone's no longer there. I need to go ahead and bleed. And you should start a period after that.
Yeah.
Other ways I could do it is, like, say I did do that. Say I gave you a progesterone challenge, you bled, and then you're still not bleeding, it didn't work, you're not having a period every month again, then at that point we might start talking about birth control pills, right? Or something where I can make you bleed when you want to bleed. You don't necessarily have to have a period every month if you're on birth control, like we said earlier. There's some women that like that period because it reassures them that they're not pregnant. Great. Or they feel like they have to bleed. Great. Whatever you feel comfortable with. But it is important to know that you basically just have to take that birth control either continuously, like we talked about, where you don't get a period, or you take it for 90 days and then have a period, or for 21 days, then have a period. So you can have a period every month, every quarter, or not period at all. And it's all safe as long as you're on some sort of birth control. Make sense?
It does. I want to make sure that we're clear on this because you talked about earlier the reason you should be concerned if you're not having bleeding is there's potential that your uterine lining is getting thicker and staying at a level that's not great. But if you are on a type of birth control that's keeping it thin, that's why it's quote unquote safe. Correct?
Correct.
Right.
Exactly. As long as you're on a birth control that has estrogen, progesterone, or just progesterone alone, and you're not getting a period, I'm not worried about you. But if you're coming to me and you're not taking any form of hormone and you're not getting a period, that is something that's going to make me do a workup. There is something to check those cells. So say you haven't had a period, I get your ultrasound and your lining is thick, 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 and it looks a little irregular. I'm probably going to do something called an endometrial biopsy. Okay. And that's actually where I go in through the uterus and I get some of those cells of the lining of the uterus. And I can actually send those off to make sure that there's no atypical cells or cancer cells there. And most of the time there's not. Most of the time it's all benign tissue and what we call anovulatory bleeding, and your body's just not telling you to bleed. But it's important that that's checked to make sure that there isn't anything scary going on.
Yeah. And then for our people that we do a full workup and everything seems good, we have to really start looking at lifestyle changes and looking at, nutrition, absolutely, how we're going to manage stress. And
that could go one or two ways, right? That could be that you're eating like crap and you're not exercising and, you're overweight and your body is just not cycling appropriately because of lack of hormone or too much hormone. But it could also be like we talked about earlier, the over exercisers that are just really stressing their body out. And that's why they're not bleeding. So there's got to be balance with both of those.
Yeah. And then lastly too, you had talked about structural issues that could be affecting people and causing this amenorrhea. Yeah. And that would obviously call for surgical intervention.
Oh, absolutely. And that's, obviously it's case dependent, but it would just come down to what your anatomy looked like on ultrasound or hysteroscopy or surgery, like a laparoscopic procedure to kind of see if anything could be done or needed to be done surgically.
Right. Okay. So I know we kind of touched on this earlier, but I think that we should spend a little time talking about how this can affect somebody emotionally and like the mental health issues that can arise from not having periods.
Yeah, absolutely. I know people, because I've seen it, they come to me and they're very fearful about fertility, right? So if they haven't had a period and they're like, well, I just never have a period. And am I going to still be able to have babies or get pregnant? That's a real issue. And that's obviously causes a lot of fear and anxiety. And so it's important that we address that. And that itself can, it's going to take a workup, right? And sometimes if my workup is benign and you're still unable to get pregnant, that's when I'm going to send you to REI, or reproductive endocrinologist, or a fertility specialist, where they'll be able to kind of do a lot more testing to figure out what needs to be done in order for that to happen. But I think that we've also touched on just the societal pressure, right? That the femininity and all of that that's involved with a period. And I don't know, like you brought up earlier when you said about, if you hadn't started your period by 6th grade, were you one of those girls and did they try to make you feel bad? Or, that's a real thing. Like, girls are afraid to talk about their periods. And I get that there's a time and place to talk about your period. But it is important that these young girls feel very, driven and very proud of their body and what it can do. And so I want to create a space where there is the potential of these girls to talk freely about their bodies without being concerned that they're going to be made fun of.
I heard a crazy, it's not even a statistic. There was a podcast I was listening to where they were talking about how society has created this, I don't know, I guess situation, if you will, where people have to have phones earlier than we did, right? And there was an expert that said that your child should not have a cell phone until the age of 14.
Ooh.
I know. Which is rough, right? Now, he did mention, like, yes, if you need to have contact of some type, you know, they'll have the watch that they can get in touch with you. But that...
Oh, a beeper?
Yeah.
That won't work.
Say it again. A beeper?
A beeper.
I know.
Do they still make those?
Well, my point is that, like, that would be very hard. I mean, that's
yes.
Everything can be turned into something when it comes to, like, I can make fun of this person for this reason. They don't have a cell phone. They haven't started their period. Like, this person is a child. It's so sad that kids have it really hard. They have it really hard.
I know.
And being a parent this day and age is so difficult. I mean, it's always been difficult, but social media, technology, everything has made things just really, really confusing for everybody. Truly.
I mean, I personally, you know, I'm raising a 14-year-old and a 12-year-old boy, and my oldest hasn't had his phone for the last 3 days because he destroyed it somehow because they're so rough on these phones. And I let him sit out with it for a while. And honestly, he seemed happier, right? He was not glued to it, which was so nice. We were able to go to Port Aransas and he didn't have his phone in his hand all the time, which was actually really nice. But on the flip side of that, I went to work today. He had a today off again because his ISD had another day off today and they don't go back till tomorrow. And he was with friends and I couldn't get a hold of him. And I was like, oh my God, I don't even have those friends' numbers to get a hold of them. So I had to reach out to the mom who he's with. And I'd be like, hey, can you have him call me so I know kind of what the plan is? And I can't tell you how frustrating that was to not be able to get a hold of him when I needed to get a hold of him.
Right. No, that's what I'm saying. It's changed so much. I was just talking to my brother and my mom about how she used to just send us to elementary school, just ride our bikes up to school. And then we'd come back. And my mom was like, I don't think that actually happened. And both Josh and I were like, Mom, we used to lock our bikes up. And then when school's over, we would come home. That would never happen today, or rarely would that happen today, right? There's just so much. And then there was another thing on this same podcast. It's related, but not, that it talked about how the rates of certain STDs have gone down. And that unwanted pregnancies have gone down. And this guy said, yeah, that's great. But the reason they've gone down is because people are having less communication outside of their little bubble and their phone, right? They're spending more time on their phone and less time wanting to go out and be a part of something. So
that's actually really sad.
I know, right? So it's like, oh, it's great that these numbers are down, but it also sucks that there's no sort of socialization anymore.
Yeah.
And
I can totally see that.
Yeah.
Mm-hmm.
Absolutely. Sorry, I digress. I mean, that was a big digression. Forgive me.
Amenorrhea, y'all.
Amenorrhea. Amen.
Amen.
Or-rhea. Exactly. Oh.
Not to be confused with diarrhea. Okay.
Yes, exactly. Okay. Jeanette, are you ready for some slippery solutions?
Slippery solutions with B and J. Ooh, that sounded good.
Girl. Okay. So we got
ready.
What? Are you ready?
No, I'm ready.
Okay.
Mm-hmm.
Dear B&J, I have forever heard that pineapple juice can help my vagina smell better.
Oh, I know.
And or taste better. I used to drink an entire bottle of Dole pineapple juice prior to hooking up.
What?
Let me read that again. An entire bottle of Dole pineapple juice prior to hooking up. I would then end up with blisters in my mouth, which then made me worry that I had herpes.
Herpes.
As I got older, I realized it was just from the acidity of the juice. Can you confirm or deny the myth regarding pineapple juice helping my vagina smell and taste better?
Oh, wow. Your poor mouth and all those canker sores.
I mean, an entire bottle, like that's wild.
That's a lot.
But I have heard this myth before. This is not wild.
I have too. And I would agree that it's just a myth. There's nothing that you're going to ingest that it's going to make your vagina taste better. I think that's important. It's not going to be like, I'm going to eat this pineapple and I'm going to taste like pineapple. It doesn't work like that. What you could do to improve your vaginal health would be the probiotics we talked about, right? So a good flora is going to make it where it doesn't taste bad or smell bad without having like an infection there, right? So pineapple juice, I'm sorry to say, sweetheart, but you didn't need to drink all of that. All you had to do was take a probiotic.
I love pineapples, by the way.
Me too.
And if there was a way for me to eat enough pineapple for me to taste like pineapple,
smell and taste better,
I would jump on board with that. But I agree with Jeanette. This is a big fat myth.
It's a fat myth. It's busted.
Okay, thank you for that. All right, number 2.
You're welcome. Ready?
I'm on the newer ring. 1 year with it already. But I have noticed that I cramp really bad the weekend before I take it out for me to have my period. Mm-hmm. Should I take it out when I start cramping? So before my actual takeout day, or should I wait until I have to remove it? I have been waiting for my removal day, but I just started questioning it a bit more.
Yeah, I would go ahead and keep it. And the reason why is because that NuvaRing is actually good for, honestly, if you wanted to take like we were talking about continuously, you could leave that NuvaRing in for 4 weeks and then just put a brand new NuvaRing in. You don't have to have a period on the NuvaRing. But what's probably happening is that estrogen is getting low enough and the progesterone is getting low enough where your body is starting to sense that. So it's starting to cramp a little bit. You might want to talk to your primary care or your gynecologist or whoever takes care of you about switching your birth control up a little bit. You might need just a different form of birth control for a little bit so your body doesn't get used to this NuvaRing, because it sounds like it's trying to start a period. But I would not take it out early. I would leave it in because you want that control or that birth control to last throughout those full 3 weeks to protect you from pregnancy.
Thank you, Jeanette.
You're welcome. You're welcome. I have something for you.
A question?
Nope. We're going to do a little quiz.
Oh, God. Okay.
Are you ready? Are there any more slippery solutions?
No, ma'am. There was just 2.
Okay. Well, I hope you're ready for this.
I don't know why we're doing this on the podcast, but I can't wait. This is okay for everybody. I have no idea what's about to happen.
Okay. So if anybody is listening to this, there are some new slang words out that these teenagers are using. Okay. And my house literally is a whole nother language sometimes when we're here at the house and the boys are talking back and forth. And so I have a quiz that I'm going to give you these words and you're going to tell me what you think they mean. And I think you're probably going to do pretty good on it because you're so hip.
Oh, I'm hip AF.
Okay. Okay.
No cap.
Are you ready? No, that's one of them. I knew it. I knew you were going to totally ace this.
No,
I failed miserably. Okay. So if I tell you, Brittany, you are so Sigma, what does that mean?
I'm obviously super hot.
I think that's going to be your answer to all of these.
What does it mean?
So Sigma means like you're good. Like it's great. It's awesome. Like when I say, hey, did y'all like your dinner tonight? They're like, that was Sigma. And so that means like it was so good.
I hate it. But okay, next.
Okay. So now I would say, Brittany, if I told you were skibbity, what does that mean?
One more time.
Skibbity.
That means I can, like you are. That means I can like jump real high and like skibbity. Skibbity cup.
Skibbity. No, it means you're bad. Like not good.
Oh my God. What?
Yeah. Okay. You ready for this one?
Yeah.
You are delulu.
Oh, well, I'm crazy. You're like, what? You dumb.
Yeah.
Yeah.
Delusional.
Yeah.
You got it. Okay. You already said this one.
No cap.
But cap. Yes.
Yeah. Yeah, I actually have one for you that I learned this weekend from my brother. So,
okay.
What does it mean?
What about,
go ahead.
Okay. What about that girl got a giat?
I got a good butt.
That's right. Yeah. Yes.
They ain't lying.
You know what that stands for?
No. What does that stand for?
Girl, your ass is thick. Giat.
Jesus.
I am like so with it with these boys.
I can't.
Okay, last one. That's sus.
Oh yeah, we know about sus. Like that's I don't know if I believe that. That's sus. Like,
all right, Brittany, I think you got like a solid 50.
Yeah. Listen, I will continue to be hip. There's actually a new thing that people are saying, like that's negative aura.
Negative aura.
Yeah.
Yes.
Like 3. I don't know. There's like some thing to it. And I was so confused, but
how many auras did you get? Did you get negative aura or positive aura?
I literally have no idea. Because I just kept, if it was my brother telling me, so I'm sure they were all negative, like giving me.
Was it Chandler or Josh?
Chandler. Yeah.
Oh, he was probably sweet. He was giving you positive aura. Yeah. Josh would have totally given you negative aura.
Oh, I don't know. At this point, I'm not sure. Well, I'm so glad that we have now educated everybody on the lingo of the youngins.
Absolutely.
Yeah.
You know, they need to know about amenorrhea and how to treat it, but they also need to know how to speak to their teenagers. So
yes, we're here for all things.
This is where the lube tube comes in handy.
Absolutely.
You know?
Absolutely.
Yeah. Yes.
Okay. I think it's time to wrap up. Do you have anything else to add to Amenorrhea?
No, I mean, I just think that we've pretty much touched on everything as far as the reasons why and what's going to happen. But, you know, go see your provider if it's been over 3 months. You're going to get some labs done. You're probably going to get a pelvic exam. You're also going to get an ultrasound. And from there, y'all will get a plan set to figure out what's going on.
Absolutely. And just an aside, shout out to a good friend of mine for asking us to do this episode. It's actually really helpful when people give us suggestions because, I mean, we could certainly talk about something every couple weeks, but it's much easier when someone shows interest in something. So don't hesitate to reach out. We love it. But thank y'all for listening. And that's all I got.
That was a good one. All right. Later.
Bye. No cap.
No cap. The information provided in this podcast is for general informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. There is no provider-patient relationship formed. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. The hosts, guests, and producers of the podcast do not assume any liability for the application of the information discussed. Reliance on any information provided by this podcast is solely at your own risk.